Let me yield the floor to my colleague from Idaho.
Thank you very much. I appreciate the senator from Arizona and the comments that he's made, and I appreciate the opportunity to be here with my colleagues from Mississippi and Florida as well. You know, when the people of the United States talk about health care reform, what they're seeking is some way to control the punishing and skyrocketing increases year after year in health care insurance costs and medical costs, and better access and quality of health care. And yet when this 2,074-page bill that was crafted in secret for the last 2 or 3 weeks was finally revealed, that's hardly what we got. In fact, the reality is that this bill will drive up the cost of health care insurance and medical care in this country. It will increase taxes by hundreds of billions of dollars. It will cut Medicare by hundreds of billions of dollars. It will grow the federal government by $2.4 trillion of new spending over a 10-year period. It will push the needy uninsured not into subsidized health care insurance, but into a failing entitlement program, Medicaid. It will impose a damaging unfunded mandate on the states that are already strapped financially. And it will leave millions of Americans uninsured while creating probably the most enormous and massive extension of federal control over our economy that we've seen in our country, starting with the creation of a new federally owned and managed insurance company. Well, today, as the senator from Arizona has indicated, we're here to focus on the Medicare cuts aspect of this proposed legislation. The Senate bill contains something in the neighborhood of $500 billion of cuts in Medicare. And the first one that I want to focus on is the one that the senator from Arizona has already identified, and that is the Medicare Advantage cuts. The Senate bill contains $118 billion in cuts to the Medicare Advantage program. And let me just talk about that program for a minute. Currently, there are nearly 11 million seniors, as has already been indicated, enrolled in Medicare Advantage. That represents about 1 out of 4 of all Medicare beneficiaries in the United States. In my home state of Idaho, there are more than 60,000 Medicare Advantage beneficiaries, which is about 27% of the population in Idaho. In addition, this is an extremely popular program. A 2007 study reported very high overall satisfaction with the Medicare Advantage program. 84% of the Medicare respondents said that they were happy with their coverage, and 75% would recommend Medicare Advantage to their friends or family members. And yet, despite this, there are massive cuts coming forward in the bill. Now, why would that be the case? I don't think most Americans who are not on Medicare recognize the difference between Medicare generally or Medicare Advantage. But Medicare Advantage was a modification of the traditional Medicare program that frankly was put into place, was it not? I might ask my colleague from Arizona to comment on this. Wasn't this put into place when the Republicans were in control, helped market forces more engaged and involved in the administration of Medicare benefits?
Just quickly say the answer to that is yes. The idea was that seniors were complaining a lot about the existing program. And for one thing, a lot of folks in rural areas were not receiving good and efficient and quick care because they had to drive long distances. They couldn't find a doctor who would serve them. The hospitals couldn't take care of them and so on. And one of the things that Republicans tried to figure out is how could we incent the insurance companies to put together pools of physicians and hospitals to go into these rural areas and take care of citizens that live there. The Medicare Advantage program was one of the ways in which that was done, and it's proved, as the senator said, to be very, very successful.
And this is the point that I want to make. If you look at the federal entitlement program of Medicare, the portion of Medicare that truly does have some private sector involvement, where private sector companies can come in and contract to provide the government's responsibilities under Medicare, is the most popular of all Medicare programs, the one that was growing, the one that was letting the private sector deliver the benefits. And one of the aspects of the Medicare Advantage program is that senior citizens on Medicare Advantage actually get additional benefits beyond those traditional Medicare benefits that those in the normal or standard Medicare program don't get, because the private sector options have been able to identify ways to enhance and create opportunities for greater and stronger benefits. Yet those who do not want to have anything but a single-payer system. Those who want to make sure that the government-provided health care is provided only by the government do not like the Medicare Advantage program. And so it's not surprising that we see this level of cuts in this program. During the Finance Committee markup, the CBO estimated that the value of extra benefits that Medicare Advantage plans provide will drop from $135 a month of extra benefits to $42 a month of extra benefits based on the cuts in the bill that we had before us then. Let's put up this chart. The CBO, Congressional Budget Office Director Elmendorf, confirmed this during the markup. Specifically, I asked him, so approximately half of the additional benefits would be lost to these current Medicare Advantage policyholders. And his answer was, for those who would be enrolled otherwise under the current law, yes. In other words, compared to current law, if the cuts put into place that are proposed are put into place, about half the benefits would be lost to these Medicare Advantage beneficiaries. We now have more detail on that, and I'm sorry we don't have a bigger chart. We're going to have one for future parts of the debate. But if you can see the United States here, those states that are in the deep red are the ones that have cuts in excess of 50% to their Medicare Advantage beneficiaries. And those that are in the lighter red are between 25 and 50%. And you'll notice those in the white, there's only 5 states that are in the white, are the ones that do not have a negative impact. So 45 of the 50 states will see significant reductions in the Medicare Advantage benefits that are provided to their constituencies. And you just have to look at this map to see that it's a large percentage of those 45 states that are getting the cuts in excess of 50% of their benefits.
Would the gentleman yield for a question?
Yes.
So, gentlemen, I think I understand that you're saying that states that have these folks who are in Medicare Advantage now are going to have big reductions in the benefits that they receive. And my understanding, this is flu shots, eyeglasses, hearing aid, as the senator from Arizona said, programs to keep seniors in health. And these are programs that I understand that my folks in Florida very much appreciate the Medicare Advantage program. We have more than 900,000 Floridians who are in Medicare Advantage. So I want to make sure that I understand this correctly, is that under the proposal that's been put forward by Senator Reid, we're going to make substantial cuts to Medicare Advantage and the benefit that Medicare Advantage provides?
That's absolutely right. And the way that I look at it is it's the extras. You'll hear some say, well, Medicare benefits aren't being cut by these proposals. That is a real stretch. But when you look at Medicare Advantage, it's an outright misrepresentation, because the benefits they get are vision benefits, dental benefits, the kinds of preventive medicine and the mammograms and the PSA tests and the other types of things that we have found now help you to dramatically increase your health if you pursue these kinds of preventive medicine options, are the ones that will be deprived through these benefits.
Well, if the gentleman would yield.
Yes.
I noticed that in Senator LeMieux's state of Florida, that reduction, according to the CBO map, would be 81%. An unthinkable drastic change in the Medicare Advantage law. In my area of the country, Arkansas, for example, a 40% reduction. My state of Mississippi, a 51% reduction. And in our neighboring state of Louisiana, and these are just examples, an 81% reduction, the same as the proposed reduction that this legislation that we have before us would do for the state of Florida. So I think it's important for our constituencies to understand the magnitude of these Medicare Advantage reductions.
Absolutely true. And taking just a couple of other states as examples, California 68%, Arkansas 40%, New York 69%, New Mexico 65%, and the list goes on. And the point here is these are cuts. The CBO director has made it very clear that these will be benefits that Medicare Advantage holders will be losing. And now, Mr. President, I'd like to move on to some of the other reductions in Medicare, because the ingenious argument that is being made by the proponents of this bill is that we can cut $500 billion out of Medicaid and not impact anybody's benefits or the quality of the medical care that they are receiving. Well, that's simply not true, because where do the other cuts, the non-Medicare Advantage cuts, come? They come from home health agencies. They come from home health agencies, hospice, skilled nursing facilities, and hospitals that provide care to seniors and other Medicare providers in what is called the market basket. These cuts, you might say, well, we can just continue to cut the compensation or the allocation of return for procedures and for health care provided in these medical provider services and not have any impact. But the reality is far from that. What will happen? Well, I'm going to give you a couple of specific examples, but in general, what happens is when a home health agency or a skilled nursing facility or a hospital receives these massive reductions of over $100 billion worth of cuts in these areas, they have to adjust somehow. And let me give you some examples, because the adjustment is this. In some cases, providers simply stop taking Medicare patients because they can no longer make a profit. And in that case, the Medicare population loses access because they have fewer providers from which to choose. In other cases, they reduce services or reduce employees. And again, both the quality and the quantity of healthcare services to seniors is reduced. Some examples. A few weeks ago, I spoke to Gary Teton of Idaho Home Health and Hospice about the impact of Medicare cuts to his business. He described to me just how bad the fiscal situation has already become for home health care, hospice, and other Medicare providers in Idaho. They have already lost nearly 30% of their providers. Now, let me repeat that. Already, nearly 30% of the home health care providers have gone out of business because we are squeezing them down so tight. And that included Idaho's largest provider. The providers that are still in business are working under the same Medicare reimbursement levels they received in 2001, 8 years ago. And if the kinds of cuts that are contemplated by this legislation go into effect, on top of the current reimbursement issues, the situation will get worse. Gary said, he compared this to me with farmers in Idaho. He said, most farmers don't grow just one crop. He said, those of us in the Medicare and in the home skilled nursing facility, home hospice and health agency facilities try to provide as many services as we can. And all of this will get reduced. Let me give you another example. Robert Vandemer from the Idaho Healthcare Association talked to me about the impact on skilled nursing facilities. Skilled nursing facilities, like the hospice facilities, already face a budget challenge under recent CMS rules restricting their compensation for the services they provide. The cuts they have already received, not counting what will come at them in this bill 100-fold more, have already caused a reduction in reimbursement in Idaho by over $4 million per year to skilled nursing facilities. He pointed out to me that in the nursing home world, more than 70% of the expenses they have are labor, primarily nurses and nursing assistants. He said that when payment cuts like these occur, they can't just go to their buildings and take bricks out of it. What they have to do is to reduce their employment. That cuts employees. That cuts benefits and services to those who are there. So let me just make this clear. First of all, these cuts are going to reduce jobs. And secondly, they are going to directly tie to the quality and numbers of staff who are there to provide care for those in the Medicare system.
Mr. President, I might ask if my colleague would yield just for this quick question. We've talked a lot about the rationing of health care that is the inevitable result of these cuts in this bill. That when you reduce the amount of money that you compensate hospitals, doctors, nurses, and others with, they can't provide as many services. Some leave the business altogether, as you pointed out. Some businesses go out of business, so there are fewer entities providing the care. That means that it takes longer for patients to obtain the care where it is available, and frequently they don't get as good a care because folks just can't take that much time to take care of them in that sense. Would my colleague please talk a little bit about his concerns about the overall problem of rationing that comes from the reductions in the benefits to providers. And by the way, your chart, I just want to say, it says other Medicare cuts to providers. We use that term providers around here as a shortcut term, but would my colleague explain in what it really means to a 70-year-old woman in Idaho? Who's a provider and how important is that, and what happens when you don't pay that provider so that provider is no longer available to take care of her?
Very much, I appreciate that question. And who are the providers? Well, if this Medicare beneficiary is in a skilled nursing facility, the provider is the facility itself, which I said we've already lost 30% of our facilities. And it's the nurses and the nurse assistants who are there to assist them and care for them. And the bottom line is you simply cannot cut hundreds of billions of dollars out of these services and expect to provide the same level of access and quality and available home or health care. The same would be true if the care were being provided in a home setting, which a lot of the home care services are compensated by Medicare, or a hospital, which is there to provide in some of the most serious types of circumstances. But whatever it is, whether it's home hospice care or a skilled nursing facility or a hospital or what have you, what we see is a reduction of the numbers of facilities and personnel available, and that is nothing other than rationing. Now, it's a different kind of rationing than will occur under some other parts of this bill, where the government will actually get in the business of saying what kind of health care you can get and at what time in your life you can get it. But it's a kind of rationing that simply forces the availability of health care down so far that the system itself rations it out.
Yield?
Yes.
I just want to follow up on my colleague's point. With all of these cuts to Medicare, $464 billion in this proposal, $192 billion in reductions to most services, $118 billion in cuts to Medicare Advantage, $21 billion in cuts to hospitals serving low-income patients, $23 billion from other sources. It seems inevitable that seniors are going to have a lower quality of health care. And we were told by the President that if you liked your health care, you were going to be able to keep it. But it seems to me that we need to change that a little bit, because under this proposal, you might be able to keep it unless you're a senior. And that seniors are really going to have a diminished quality of health care under this proposal. Is that correct?
The Senator is absolutely correct, and I will comment on that and then conclude and turn some more time over for remarks to my colleagues from Mississippi and Florida. But that is exactly right. In fact, one of the most clear and obvious places in which this legislation violates the President's pledge that if you like what you have, you can keep it, is in Medicare Advantage, because 1 out of 4 Medicare beneficiaries in America will not be able to keep what they have, and will see their benefits cut. There are also other parts of this bill that impact people outside of Medicare in terms of the kind and quality and extent of health care insurance coverage that they have and expect that will be impacted. So it's going to impact beyond this, but this is about as clear a case as there is of violating that promise.
Before the gentleman leaves that subject matter, I wonder if I could interject this. Now, we've listed, and my friend from Idaho also has listed specific cuts under this legislation: hospitals, Medicare Advantage, cuts to nursing homes, cuts to home health and hospice. But also, I think senators and Americans need to understand that the Reid bill also establishes a permanent board of unelected members appointed by the administration, which in this case, initially at least, would be the Obama administration, and they would dictate further savings under Medicare. And this gets to my friend from Arizona's question about rationing. It would dictate annual Medicare cuts geared toward reducing Medicare spending. Now, these people are not going to be like us and accountable. They will not have to go back to their districts every 2 years or their states every 6 years. But they will have the unbelievable power under this legislation to dictate additional cuts that we know not of. And the Wall Street Journal called this a rationing commission. And this ties right in with the concerns that Americans have had over the last 2 or 3 days about these recommendations with regard to mammograms. I have, and I realize I'm intruding on the gentleman's time, but I have a letter here from a physician in Mississippi who is fearful that this sort of rationing board is going to impose the requirement that mammograms not be given until after age 50. And he says, my wife and I have 2 daughters who had breast cancer in their 40s. One daughter was 42, and it was picked up on a routine yearly mammogram. The other daughter was age 49, and she found an abnormality by self-breast exam, and it was confirmed by a mammogram. Now we have a group of unelected people coming forth and saying, you're not supposed to get a mammogram. You're not entitled to a mammogram. And we've learned, Mr. President, that some insurance companies have already decided to follow that dictate. And this gentleman, a physician, says, my 2 daughters would be dead from breast cancer if that were imposed. I'm afraid that in addition to these very definite cuts, this permanent board of unelected members would impose the very type of requirement that we're fearful might come forward on mammograms.
Well, the senator is correct, and I'll conclude with this. I think we've all seen that folks are almost falling over themselves, backing away from the news on the mammograms that came out just now. But it's a very clear example of the way in which a study can come out from a government source or otherwise to say that, well, we don't really need to have this kind of health care in the United States, and it's a cost saving. And what do you think is the potential for this commission to say, well, we are charged with saving costs in these programs, and we're going to do that? Now, I suspect that the mammogram issue is one that they wouldn't dare do it politically today on because of the reaction to it. But the point is, somewhere this commission is going to save tens of billions of dollars in addition to these kinds of cuts by reducing services. And try to, color it as you want. You cannot make this kind of reduction of health care services, personnel, and infrastructure without reducing the access to and the quality of care that Americans receive. I'll just conclude by saying these issues face every state in America. And we are going to see in this arena a dramatic reduction of the quality and content and quantity of health care that our Medicare beneficiaries today see because of these proposals, and they are being done not in order to make the Medicare system more solvent, but to finance yet another major federal entitlement program that will cost hundreds of billions of dollars. As a matter of fact, if you look at the true numbers, the cost will be over $2 trillion in a full 10-year period of time. And so there's a lot more that we could say, but I know that my colleagues from Mississippi and Florida have some remarks that they would like to make, and so I will yield to them at this time.
I guess I'd ask my colleague from Idaho, isn't it true that the biggest dollar cuts to Medicare are going to come because we're going to pay the doctors and the hospitals and the nurses a lot less money? And of course, every one of my constituents that have talked to me about this said, wait a minute. If you're going to pay them a lot less money, I'm having a harder time finding a doctor that will take Medicare patients. Isn't that going to result in delay of care for me, in denial of care, in effect, rationing of care when there aren't enough doctors and nurses that'll take care of me anymore because they're not being paid enough to even keep their doors open?
Well, the senator is absolutely right. As a matter of fact, if I understand the legislation correctly, it assumes that the current projected cuts for physicians are going to happen. That's how it says that it's not going to increase the deficit. Now, you and I both know that this Congress will not let that happen. But even today, 29% of Medicare beneficiaries looking for a primary care doctor had a problem finding one, because there are, both with regard to Medicaid and Medicare, because of the problems we've been discussing here, there are fewer and fewer providers who will take patients in those programs.